I always tell my patients, which may be dating myself a little bit, but Michael Phelps, I feel like that's when cupping really took off. When he was in the Olympics, he had the bruising all over his shoulders and back. My name is Joe Bell. I'm a physical therapist with Franciscan Health Physical Therapy. You do not have to be an athlete. We do this on everyday folks as well. It just became very prominent in the athletic community, mainly for kind of like preventative things as well as recovery, just because they were, an athlete is going to be performing at high intensities, repeated in short windows. But yeah, any treatment that can be done on an athlete can be done on a common person as well. Yeah, so cupping is known as a soft tissue mobilization or manipulation technique. There's a wide range of different treatments that can be done for that effect. Cupping is just one of the treatments. So cupping uses a plastic suction-based cup. We put it on the target area that we would like to treat. It uses air pressure to be sucked up and raises the skin and the fascia up off of the muscle. So that's in theory what it is. It's meant to help, increase blood flow, release any tension or tightness in tissues. So it can help pain and definitely help improve function. So this is just the cupping cups that we use. You can find different varieties of these types of cups, different sizes, this is a glass cup, you can have plastic cups. So they come in a lot of different shapes and sizes. This is just the applicator to create the tension. And you would put this on, any area of muscle tissue. Typically larger areas are going to be better with a larger cup. And then you would just kind of pump it up to your desired kind of suction, and it's going to kind of lift that tissue up. So it's probably varies based on the therapist who's choosing to do the technique, but it all kind of bases off the initial evaluation. At that first visit, when you come and see us, we'll evaluate, the problem area. We'll palpate around on the different soft tissues and structures, determine a good treatment area, and then if we feel that you can benefit from some sort of soft tissue mobilization technique, cupping is a great option to try. Different tissues in the body, you pretty much have your joints and your soft tissues in your musculoskeletal system. So soft tissue would be anything related to like a muscle or a tendon or a ligament, any of those soft structures versus like bones, where two bones meet would be a joint. So a lot of times in therapy, we manipulate either the soft tissue structures or the joint structures to create a desired outcome. Cupping can be applied to pretty much anywhere you have a muscle, which is pretty much everywhere on your body. So common areas that we would treat would be the neck and back, just because those are big, large muscles. They're commonly overused. People commonly have a lot of like postural impairments. So it's a very good area to target for treatment. And pretty much we would just palpate around, find good spots that are kind of tight or tender or have some tension in them, and that's where we would apply the treatment technique. So what does it feel like? It can vary once again, kind of depends on how tight or inflamed or irritated that area is prior to being cupped. But it's relatively comfortable, and the therapist has the ability to modulate how tight they make it. So, if it's maybe your first time, we would go a lot less intense or less pumping than, somebody who's experienced and has had it more. Because the more you pump it up, in theory, the more it's going to create that tight kind of suction treatment effect. So when you have it on though, it's just kind of, you feel a light suction. I've had patients sometimes, complain of some small side effects of like it's a little bit tight or itchy or kind of irritable. But that's part of the treatment because it's creating that tight kind of decompression. And then when you relax it, it's going to go back to kind of its normal resting position. So that's some of the treatment effect. But in short, it's relatively comfortable. Most people don't have pain really during the treatment. So there's really not a lot of side effects. The big ones would be maybe some potential soreness for a few days. And then depending on the intensity at which you perform the cupping, there could be, prominent bruising. which is just from the blood coming to the surface. So similar to like you bang your arm, you have a bruise, it's kind of the same type of feeling. Not as intense, but the bruising can be pretty prominent, like kind of circular, sort of in the, you know, the shape of what the cup looked like. And those can last anywhere from, you know, 1 to 2 weeks, depending on how intense you did the cupping. Sometimes there might be no bruising, depending on how long the duration of the treatment was and how intense the treatment was, can vary the side effects. I think for like a day or two, it might be a little bit tender, but after that, it pretty much goes back to its baseline. Even though you have a bruise, it doesn't feel like, like it's really tender, like